Hey everyone, thank you for joining us today. A very warm welcome to our LinkedIn audio event, Transforming Healthcare with Blockchain. Together, we will be exploring how blockchain and AI are shaping the future of healthcare. So let's start with a quick round of introductions. My name is Akash Agrawal, and I'm your host today. I consult CXOs and business leaders on growth strategy in Web 2, Web 3, and emerging technologies. I have over 2 decades of experience. In my corporate avatar, I led brand marketing and businesses at Sony, Nike, and Walmart. My co-host today is Sean Delaney. He's a co-founder of a LinkedIn content agency, Doers Growth, and an experienced brand consultant. With 15 years in business development and marketing, Sean brings a wealth of knowledge and a passion that I can vouch for all things Web3 and AI. So today we are joined by 2 fantastic speakers, Jean-Philippe, JP for short, and Rahul Reddy. Jean-Philippe is the founder of Symbionic Foundation, where he's building a decentralized ecosystem that aligns economic incentives with positive health outcomes. From developing wearable tech to pioneering new models for health data ownership and monetization, JP is at the forefront of longevity revolution. Welcome, Jean-Philippe. Rahul Reddy is the CEO of Healthera AI. He's a former dentist with over 13 years of clinical experience. Healthera AI is in the field of education and training that goes beyond emerging technologies, and they're based out of Bali. Welcome, Rahul. Thank you for joining us today. The event is brought to you by Maven Hub, so don't forget to give our page Maven Hub HQ a follow to stay updated on upcoming events with top experts in emerging tech. And for everyone tuning in, do stay with us until the end, where you can engage directly with our speakers in the Q&A section. Just raise your hand and we will bring you on stage. And as a quick note, the views shared here are personal and meant to spark ideas and conversations. They're not financial, investment, or business advice, so please do your own research. Okay, so essentials out of the way, let's get started. So the healthcare sector makes up about 11% of global GDP, so that's roughly $9 trillion. With rapid advancements in blockchain, AI, and other digital technologies, we're on the brink of a major transformation in how health is managed, secured, and accessed. Our speakers will be talking about this today, so don't go anywhere. To start, let's dive into the bigger picture. And this question is for both of you, but let me invite JP to address this first. As blockchain emerges as a critical technology for distributed trust, what broader vision do you see for healthcare as these technologies get integrated?
Yes, thank you. And so good evening, good afternoon, and good morning for whoever is listening from different parts of the world. I think the healthcare sector is really on the brink of disruption in that respect. First of all, in my thinking, because in many ways healthcare is still very much sick care. And for what we are working on, we're very much interested in more the preventive care side of things and how to keep people healthier for longer and potentially all the way to defeating aging. So when you look at that, the trust model in healthcare and how it can empower individuals, it's really about giving them control over their health data. Now, when people talk about blockchain and centralized systems, they quite often commingle both. So if you want to be super correct about these things, you actually have to clarify that blockchain is not necessarily meaning a decentralized model. There are many forms of blockchain that are very centralized. So that's one distinction to make. Decentralization often also refers to the storage of data. Data storage can be decentralized, as in spread around a network on a peer-to-peer sort of model. I don't want to get too technical, so please stop me if I get too geeky. But this is quite an important distinction. And for the purist, when they talk about decentralization in Web3, for example, they will always also talk about governance. So it also means like community-driven, like decentralization of the governance, not having just decentralization of the data and having a small group of people control everything. But they also mean decentralization of the governance. So how can that benefit the healthcare sector? Well, for us, it's the technology is more under the hood. What we're looking for is how to deliver a way for people to actually take ownership and control over their data. So it's more about using blockchain as a proof, a secure proof, a verifiable type of proof record to make sure there hasn't been any tampering with the information. Our storage is a decentralized storage that also allows people to actually, what we call in cybersecurity, reducing the attack surface. So if you crack into a part of the information, you will actually realize that it may be just a little bit of heart rate data, but not the whole information. In centralized servers, when you crack into a server, you basically crack into the whole thing. You've got all the customers, all the data, everything at your reach. Right, so reducing the attack surface by spreading the data around, at least at rest, it is a really important, secure way to actually operate. Mm-hmm. So maybe a quick explanation in a nutshell of what we do. We built an ecosystem on which people can build apps and services to deliver them to users, and we power that ecosystem through a health wallet, which is an app in your phone, basically, which allows you to see a health score because you can patch in all your wearables, and then can walk the journey of getting healthier, improving your score, and as you do, you get to earn some points, and you get to actually upload more data and more things about yourself. And that's why trust and verifiability and decentralization is a key component for us, because people can't trust that this wallet is truly their health wallet and they are truly in full control of it and ownership of it. Nobody else is seeing or tampering with the data, then we won't get the adoption that we need to have. So that's it in a nutshell.
Thank you, JP. And I think you earlier on itself, you made a very great distinction that everything blockchain is not necessarily decentralized. So maybe we want to put in a term called distributed trust, for example. I don't know if that fits in nicely, that you can have a permission blockchain, but then still the trust gets distributed in the sense that everybody has the same view to the same kind of data and verifiability of that data and so on. So that's pretty amazing. And we'll definitely, as we go along down this conversation, we'll dive a little more deeper into what you're building and what stage that you're at, and if folks can start to use it right now, off the bat. So Rahul, over to you. Same question. What are your views on this? Would you want me to repeat the question?
No, I'm good to go. Okay. So I'd probably reference actually one of the listeners, I believe, is listening to us. It's Dr. Colin McCourt, who actually referred to.
Colin is on here.
Akash. And actually, when it comes to hospital settings, particularly administration, I'm going to take a different tack here, obviously being the career being a clinician, and Colin is still working within hospital systems. Bureaucracy is often implemented where trust is lacking. And in a hospital-based system, just for example, the doctor prescribing the right medication is important, and that person needs to be verified, i.e. the doctor and the patient. Then they go to the pharmacy, and then the pharmacy has to have a trust in that script, whether it's physical or digital, makes sense. So I believe, don't quote me on this, but Colin suggested something like 30 to 40% of management time and administration time is spent on trust and ensuring trust occurs in a hospital environment with thousands of patients coming through, maybe tens of thousands of patients coming through, hundreds of doctors coming in, specialist consultants. And so you can imagine that cost burden is significant. So blockchain essentially is a way to increase the trust within stakeholders within an organization. And I'm very commercial in my mindset, so I will very much simply say it comes down to reducing the cost to ultimately benefit the patient. So if we're able to implement blockchain in an administration setting, you get a significant improvement on that alone. The second point is, having worked on the front line with patients, and once again, Colin could attest to this, many doctors and dentists listening can attest to this, is that we also have very siloed information in many databases around the world. Now, some of these databases, especially in developing countries, are still operating on paper-based records. So I think this conversation goes to the depth of when we talk about digitization, we have to understand that there's a predominant aspect of the world or component of the world where they're not even digitized. So when you've got siloed information which is yet to be digitized, and then you've got digitized information that's in so many databases with different customer relationship management software, patient management software, we need to be able to extract that data. So by ensuring that we are actually able to implement blockchain solutions to be able to share that data in a distributed manner, in a decentralized fashion, that means we can actually unlock the power and that potential of the data. And data is, everything from business information and analytics. But as clinicians, data is what we form our diagnosis from and the treatment plan. So it's essential, absolutely essential, that first of all, this digitization occurs, but also, once again, I believe blockchain is one of the most cheapest forms, not necessarily the least elegant, most elegant, but a cheap form to be able to distribute data in a rapid fashion. And that is really critical because we need data to be able to improve diagnosis algorithms, which then leads to better treatment algorithms. But at the same time, I also have to agree with JP in the sense that permissioned data by the patient is also critical, because not every single patient understands the value of giving up their data to help the person around the corner. They can be educated, that'd be fantastic. So I'd say, reiterate, from a hospital administration standpoint, improving the efficiency of trust management, if you could say, that would be an improvement in how things are done currently. Being able to extract data from siloed databases and to be able to distribute them in a decentralized fashion and enable clinicians and academic researchers to be able to access that data, that would be fantastic. And then finally, in a situation where there is no current system to actually capture data, you can imagine in extremely remote places, we have a massive opportunity now with everything that's going on globally, politics aside, when we are able to access internet through, for example, I think it's Starlink in memory. We have a unique opportunity where in certain communities, the first type of actual data capture and distribution could actually be platforms based on blockchain. So rather than reinventing the wheel, we're actually implementing a solution in some of these places to extract that data. And as we know, just based on world demographics and understanding of population distribution, data from millions of patients for the first time ever giving their data up can be very useful in improving artificial intelligence algorithms, data capture and diagnosis. And the best part is that we have a first bite of the cherry situation where we don't have to worry about extracting and converting the data from large-scale databases. So to me, blockchain increases trust in those three ways. It reduces the burden on hospitals and administrations. It enables data to be extracted in a simple, cost-effective manner from existing databases. And finally, it can increase the speed. I'm a big proponent of the speed at which we can actually capture data at point of contact and then be able to feed that data into algorithms to make them useful in a rapid fashion. And I think with 7 billion people on the planet, that could be something that could be achieved by the end of the decade, next decade.
Thank you, Rahul, for that very detailed insight. I think right from the numbers that you shared and in terms of impacting administrative load to digitization of data, being able to extract it and being able to share it, and also education, which also plays a very, very important and critical role, specifically when you look at it from a patient's perspective, because many of them or most of them are not even aware of the importance or the criticality of that data. So that sometimes gets just shared. So,
Akash.
Yeah, go ahead, JP, please.
Yeah, I just wanted to react because I think Raul said something really interesting. And we talk a lot about the collection of the data, etc. I want to make a distinction here is that our thesis is also about putting the patient or individual at the center of this equation with the data, because most of the time we kind of forget, we record consent, sign at the bottom there, and then we'll use your data. And of course, we're going to cure cancer, so please just let us have everything. I think one of the big transformation we can achieve in this industry is by getting people to take control and ownership of their own health. And for that, they need to have a sense of empowerment with their own data. So my thesis in what we are building is that we put the users at the center, we put the patients at the center, and we empower them with their own data and control and ownership of it, so that they can indeed be part of that equation when they contribute to science, contribute to research, and be rewarded for it as something that we often forget in that equation.
Great point, JP. Sean, I think you got something.
Yeah, so JP, just to kind of follow on from that, you've been working on integrating blockchain and health data. Can you give us a bit of an explanation how blockchain tech can enhance data protection and privacy for individuals' health information in the digital age?
Absolutely. Absolutely. Blockchain is really offering you an unparalleled level of security and transparency. It's this sort of interesting capabilities of blockchain. One, to be an immutable ledger, so in terms of verifiability and control, and Rahul talked about a collection of the data. I'd also probably add the accuracy and the quality of the data is important. So recording that in an immutable way is very important to know that you can actually trust this information. I had quite interestingly earlier on today, I had a conversation with someone in the US who was a healthcare professional who was pointing the finger and telling me how sometimes wearable data isn't very reliable, and so it's very hard to form a clinical opinion on data that is potentially not completely trustworthy. So that's something probably important to mention about that, the recording of the accuracy of the data. So blockchain allows you to have that ledger, but it also comes with a bunch of tools around the encryption and the privacy part of things. So you can actually generate proofs. You can encrypt the data. You can now do compute over data without decrypting the data with technologies like full homomorphic encryption. There are different possibilities to work with something called zero knowledge proof, for example, so you can verify the information without revealing the data. Don't want to get into too technical information, but basically it comes with a toolbox of tools that are really native to blockchain to actually build that privacy that you require. So it's really a shift from trust us with your data to you can control the data and you can own it and you can trust that nobody else is tampering with your data.
Love that. And I mean, that sort of touches upon the benefits from the kind of patient side. Maybe you could share a little bit more about how patient care can benefit by combining these insights, analytics from different data sources and blockchain.
Well, I think Rahul said that at the beginning also. Fragmented. And there's data everywhere, right? And there's data with your hospitals, data with your labs, data with your doctor. You have data from your wearable. You might, as I have done as well, done the crazy thing of getting your DNA tested and have your DNA sequence out there somewhere on a very secure site like 23andMe. They also did give you a sort of health risk baseline, saying, oh, this is different types of risk that you have, or you're a median or you're a high risk of this and this condition because you have this gene. So, but the thing is, all this data is in too many different places. Now, we believe that we can't solve aging as a big problem that we're all facing. and societies are growing with aging populations, and we don't know whether the healthcare infrastructure will be able to cope with the amount of aging patients. So solving conditions like this actually need having all the data in one place, so you can really discover things at the intersection of different data sources. Right now, we know that we're very much into the sick care side of things. We're very much focused on symptoms. We're very much focused on platform economies, like different people trying to get all the data in one place. If you put the patient at the center and you actually make the patient the center point of all the data, as in a data lake, let's take this image, probably is quite easy to make people understand what I'm trying to talk about. If people have a portable data lake of all their data, then an AI copilot can work on that and recommend a course of action to improve their lifestyle, to improve from a preventive care perspective, and to detect things early on. And that data can then be shared with your doctor, can then be shared with your health professional on a need-to-know basis and controlled by the users to facilitate this preventive care. And so we'll be moving the discussion from a sick care world with different competing platforms and the difficulties of having the platforms talk to each other, to now having a preventive care world where the users are in the pilot seat of their health journey.
Really cool, really cool. But Rahul, did you have something to add to that?
Yes, so just if you humor me for a second, it's a bit of a story, not a very short story, but around 2010, 2011 or so, I think Minority Report was still fresh in my mind. That's the movie with Tom Cruise, pre-crime, etc., and they were using, I don't know, some sort of Oracle characters. And I remember going to a meetup, even in 2011, after seeing a talk by Sergey Brin and Larry Page from Google founders about big data. And I remember going along, and I was a young entrepreneur, and I put together a little PowerPoint presentation, shared it with about 10, 15 people. And back then, I sort of stitched together certain concepts around big data, and even wearables like Fitbits had sort of come into it. And the concepts I was talking about back then was about being able to pick up certain chemical compounds in the blood that we know, enzymes that get released pre-heart attack, and then an ambulance being dispatched to someone's house before they have the heart attack. And we know generally that we have about 15 to 20 minutes to get someone to the hospital between a heart attack and them dying. So even if we're able to dispatch an ambulance and get there 20 minutes before they have the heart attack, that's preventing them from actually dying. And so when we talk about decentralization, if we take a big picture approach to this, decentralization and coalescing databases is not just about healthcare. I mean, imagine the amount of data we could extract from, say, ambulance dispatch database, emergency response database. Imagine if we could get wearable companies and Fitbit companies to agree to a degree of decentralization to spread that data and to be able to coordinate early response mechanisms. I did a talk about actually preventing the next COVID, and although I've got an immunology degree and I was sort of batting above my average, I don't have an epidemiology background. But the reality was I was talking about this in 2010. We're at 2024, COVID's already occurred. And I don't want to bring the mood down, but when we're talking about technology as powerful as blockchain and decentralization having been around since 2008, I'm sorry to say, but we are woefully and dismally behind where we need to be in terms of recognizing the technology and being able to integrate it, because technically speaking, what I've just told that story is, this technology can save people's lives.
So Rahul, actually, sorry to interrupt, you bring in a great point here. Before you...
Artificial intelligence, we're talking about supercharging, turbocharging the integration of databases. So to me, inflection point, yes, Maybe we're there, maybe we're not. But do the algorithms work? Yes. Are they learning at a rapid pace? Yes. Should we be ahead of the curve? Yes. Can we be ahead of the curve? Yes. And do we have the money within the system to facilitate this and the investment? Well, hopefully. Sorry, I just had to finish that point.
No, absolutely, Rahul, and I think those are absolutely brilliant points that you really bring up. And I think I just said so. We do agree. Offline we did talk about inflection point and stuff like that. So that's really a big debate. But who's really balling? Right now, if you're talking about do we have the tech, we say yes. Do we have the capabilities? Do we have the money? We say yes. Do we have the databases in one form or the other where they may not be fully sufficient right now, but maybe they're up there 60, 70, 80%? Probably yes. So when we are getting so many yeses, what really are the barriers then? Or if you're seeing any good deployments in any part of the world or any sectors, what are those really?
I think one thing I've seen, having traveled many countries, got my country count up there, and lived and worked on different continents. Once again, I think it comes down to as simple as disbelief in technology. Now, I don't understand when internet came out and then email came out. I don't remember how much disbelief people had about the fact around email and that was running a POP3 protocol and SMTP protocol. We got over the fact.
We had the naysayers, absolutely.
We didn't. We knew that letter sending was going to be inefficient, but 16 years on, whether we're debating whether decentralization works or not is not the question anymore. So I think, unfortunately, once again, without bringing it to the negative, disbelief is a massive distractor, not even an obstacle. It's an absolute distraction from the core issue. JP, I'm sure you feel the same way.
Yeah, absolutely. And I actually also want to bring a global point because we are looking at different markets around the planet, and one of the things is that the consumer protection around data is very unequal from one country to another, and so I think while I guess the point I want to make is we're almost thinking like, if you remember when mobile phone technology started spreading, it spread like wildfire in countries that didn't have a very established infrastructure because they didn't have that much landline, that much. So I think
sorry to cut you off. I'm just sorry to add a question to what you're saying, not to hijack. But why do you believe there's such disbelief about this technology versus what you're just talking about? Why is the adoptive curve, in your opinion?
Sorry, rephrase that because I don't understand the adoptive curve question.
Delayed compared to previous technology. Why do you feel that?
I didn't say that it was delayed, so I don't think it's delayed. No. The point I was making is that in some countries, there's less infrastructure in terms of healthcare. We talked about at the beginning of situations where still pen and paper, etc. I actually think these countries are typically prime candidate for going straight to a structure with decentralized storage, decentralized management of their health record, and potentially what we are offering today on the table. And I think they would probably lead the way, and rather than lagging where they are right now. It's harder to deploy these in very established country with higher levels of regulation and high levels of infrastructure already in place. I'm thinking of the US market, for example, some European countries. But if you take countries like India or Southeast Asia or the Middle East, etc., they have a less strong infrastructure network. And so they are prime candidate for blockchain and decentralization of healthcare.
Rahul, would you also agree with JP saying that advanced countries, because of regulatory aspects and maybe because of legacy technology as well, and the infrastructure and the investments required? I'm not sure if that is another reason why maybe lesser advanced countries probably are more prime candidates right now for this.
In some ways, actually, their lack of structure and all the existing infrastructure may actually be a benefit, is what we're saying, yeah?
Yeah.
Cool.
All right. So Ram, let me come back to you and talk about Hathara.ai for a bit. So you mentioned that you were into education and training, and I think when we're talking about disbelief, the only or one of the strongest paths forward is education. It's only when people really understand the capability of this technology and how it can be deployed within their sectors, domains, or within their own environments, is when they will start to experiment and then learn that, okay, yes, this is the technology that they should be working with. So since you're in this particular domain, so what has been the experience and how are you seeing Healthcare, go forward down this path?
Awesome, great question. Akash, I think it's interesting, once again, with this technology and having been through an academic background, and I'm sure many people listening can attest to this, in university we were taught some very foundational principles, and that's that education is didactic. There's a theoretical and there's a practical component. I think many people theoretically hear about things like blockchain or Bitcoin, but then very few want to experiment or perhaps even see other people utilizing Bitcoin. So I think education gap doesn't necessarily, if I had to put a gun to my head right now, it doesn't necessarily lie around the fact that people kind of understand the technology, that Bitcoin exists. Some guy called Satoshi wrote a white paper a long time ago. But to actually then bridge, I believe that hands-on education is critical. So that's what we see a massive opportunity within the healthcare sector specifically, that there's a lot of highly intelligent people, in the dentists, doctors, health practitioners, support workers. They're intelligent people. So it's not a case of that they won't understand the technology, but how to integrate its use from day to day, how to understand its applications in potentially in clinical care paradigms, in business administration paradigms. That's what we're focused on. We are trying to both impart theory, but we would like clinicians, owners, and otherwise to actually get hands-on with the technology. And I don't mean just using e-wallet. The mystery after using an e-wallet and then sending some, actual digital assets between wallets and then, getting excited that it's done so quickly and that it's trustworthy, etc. You kind of get over that. But then with artificial intelligence coming in as well, these are new technology tools. They really are tools. And I think didactic training is critical, because I can go around now around the street and tell 100 people on the street, use Bitcoin, use blockchain, use this and use that, blah, blah, blah. But how will they actually be able to bridge is by using the technology. So I would say that education, hands-on education, is absolutely paramount and critical when we talk about integrating apps and software that JP is working on, other people are working on, we're working on. Then it's a case of really just having a small group of people testing it. And that's obviously one of the calls that we made recently, is that we want a group of progressive practitioners to actually trial set the technology that we're working on before naysaying it, or before saying, look, it's too complicated to integrate. So to me, if I could summarize that point, it's didactic training, Akash. And once again, I'd love to hear your thoughts on it. But it's all well and good hearing about blockchain, Bitcoin, NFTs. But then there's a bridge to actually use it successfully, effectively, and then be able to teach other people how to use it.
I think you make a very, very important point, Raoul, and the one thing that motivates us in here is we want to make sure we actually don't need to explain the technology. It has to be, and I guess it's the consumer technology guy that speaks in me. These should be under the hood, and the mistake we've made a lot in previous Web3 industry and people talking about blockchain, etc. The reality out there is people just don't understand blockchain. They basically immediately think about Bitcoin, and then they just go like, well, I don't use that, I don't know how to use that, and I can't trust it, and I don't know. So it's very hard to engage. The solution should be working for people, and they shouldn't have to worry what's happening under the hood. This is a tech stack that's here to deliver the benefit that we promise. They don't need to have a PhD in blockchain and need to understand the intricate workings of the technology in the back end. I think that this is super important to deliver a user experience that is flawless and to the point that they would not have to worry about what's under the hood.
I couldn't agree with you more, GP. There absolutely. So technology really needs to disappear into the background, like we use our internet today. So we don't even know what's going on in the background. So the same thing absolutely needs to happen, right? So, and honestly, I mean, when we talk about wallets and NFTs and other things, they're not really easy for folks really to understand. And even setting up a wallet is jumping through hoops. Not very, very easy. So, go ahead. Just say something.
No. Just I was just going to say that we for example build a health wallet, right? And it actually has a crypto wallet under the hood, but you don't know about it, right? Basically, it looks like a health app married with a few other features in there, but you wouldn't know that it has a crypto wallet inside.
No, absolutely love it. I mean, that's absolutely the way to go. So people really don't need to know as to what technology that they're interacting with. All they're bothered about is the user experience. And as long as you're able to deliver that, it's going to work absolutely fine. So Rahul, let me put this question to you. And we talked about wallets here, so let me put up a question from a financial aspect, because that, again, is a very critical aspect of making things work. And JB, please feel free to add in from your perspective on what you're building as well. So let me link this also to a bit of AI here. So how might AI assist in ensuring more secure and optimized financial operations in a decentralized platform? So I know, Rahul, you love to talk about abundance and non-abundance. So
yes, so I think this is a good point to say, especially, to me, in some ways, when I first started working with the technology, what is it about? Well, hearing about it in 2011, to be honest, and then sort of pouring in 2015, and then working really deeply with the tech in 2019. I'm going to take some sort of liberal license here and say that I've started talking about decentralized technology in tech as opposed to DeFi. And when we're talking about different aspects of working with the ecosystem, the e-wallet tended to be something that was taken for granted. And to us, especially with what we're working on, the e-wallet that we're designing is specifically for healthcare practitioners. And to me, that is critical in being able to, adding on to what JP said, it just needs to work. The interface into the ecosystem needs to be straightforward. But when it comes to artificial intelligence, the power of AI also enables us to do credential checking. And so our KYC AML that we plan in the short and the long term, utilizing AI, I think, once again, I'm going to take a little bit of liberal sense. I'm not a CTO, I don't have a NetSec qualification, but it'll be almost unbreakable. Now, I'm not going to talk about the future of quantum computing and all that. It's too far ahead for me and where I am at. But in regards to having an interface, I think the e-wallets are critical. We're not, at the moment, on our roadmap, have any e-wallets planned for patients, and I'm assuming JP's kind of got that handle with what we're working on. But in regards to where we're working with, when we've got, once again, with no disrespect, anyone the vintage of 50, 60 years old, person who's made their money, especially in the healthcare sector, looking at retirement age, we tend to know that this demographic is not fantastic with technology. So why already make a somewhat opaque, hard-to-use technology even harder to access? So to us, the e-wallet for healthcare professionals is absolutely critical, and I believe that artificial intelligence will be an absolute use case. Now, this is one idea. We're not going to use this, but fingerprint recognition, eye recognition, these are relatively simple ways that we can use security. I'm not saying that this is what we'll be using. We'll be using more advanced algorithms and techniques. But to me, decentralized technology as tech stacks integrate together, and I don't think anyone is truly brilliant on its own. I think it's the actual integration of different tech stacks that's important. So I hope I answered that question and didn't go too sideways there, Akash, but I think it's critical, especially in KYC AML, credential checking, and ensuring that there's no identity frauds, because as we know, they're just doctors. If they're transacting large volumes of money, etc., that is a point of failure and a network security risk. But I can assure you that we're all over that. We've already understood that potential. And in our white paper, which I think you had a quiz over. That's why you're asking me that question. That's a leading question. So yes, we are definitely all over that, and that's the kind of way that we would be approaching it. But once again, artificial intelligence gives us so much power to be able to do credential checking automated and in much faster way than a manual process. Say, for example, banks currently extracting, data from clients who want to borrow money, etc. We hope that this will be a much more streamlined process. And one of my idols is Steve Jobs. I might be upsetting some people. Apple is not my favorite product. I'm an Android user, but in regards to what he did with design, Steve Jobs, one of my idols. The iPhone is so easy to use. From the day it was almost launched, an 80-year-old could use it, and a 10-year-old could use it. Yeah. That's where we want our software to be functioning that easily.
Absolutely. And Rahul, thank you so much, and we're looking forward to that white paper. And don't worry, we're not going to let the cat out of the bag. So that's absolutely fine. Dr. Amit, thank you for waiting. We'll just bring you up in a few minutes as we get into the Q&A. Appreciate your patience. Sean, you had something?
Yeah, sure. So, I just wanted to say I love that you've both been bringing up the kind of user experience aspect. I think sometimes forgotten about when we're talking about Web3 and AI, particularly Web3 and blockchain. We need to get to a point where the user experience is as it is in the Web2 environment. Because that's ultimately where the mass adoption for any sort of new technology is going to come from. So as long as there's any sort of sticky friction when onboarding, it's always going to cause problems. Particularly, Rahul, as you mentioned, in a use case where the user is as far from the sort of Web3 degen, so to speak, as possible. So they really enjoyed that. Now, looking ahead a little bit to the future and some of the challenges, we've kind of touched upon a little bit of this already, but this is to both of you, so feel free to jump in. But what do you see as the biggest regulatory or adoption challenges when it comes to decentralized models, specifically in healthcare, and then how can we overcome those?
I think we touched about it when we said this was about infrastructure that is already deployed and interfacing with this. I am working with another group who's deployed systems in hospitals and doctors, etc. And so I understand the protocol languages to exchange data between, I'm talking for those who understand that, HL7 or FHIR, all these protocol standards to talk from one system to another and get the data over. This is the stuff that you go to your doctor and he sends a script to your pharmacy directly, or he makes a referral that goes directly to another doctor, and all your data is kind of passed on as this happens. These systems need to interface with whatever else you're building, so it can talk to it, right? And that's probably something that's a little bit more difficult to do. And also, if you think about the regulations and the legal aspects, the legal aspect of consumer protection of data, HIPAA and GDPR and all these regulations, for example, they're very much based on technology that is existing from before. It actually doesn't really align well with the new, because law always catches up later, right? If you think about a decentralized system where the user is actually in ownership and control, do I really need a system like HIPAA? Do I really need, it does cover the fact that you're storing with a third party, but actually it's covering the case where you relinquish your data to someone else to take care of it. And if you are doing your job correctly with decentralization and encryption and control from the user, then actually it's like I am in full control of that. And I guess at some point in the future, we'll almost be able to challenge those laws and say that they don't apply anymore to these particular use cases.
Absolutely. Rahul, would you add anything to that?
Look, I think within our industry, and once again, I might hop with a few people, but sometimes the dynamic in how the whole healthcare industry works is that many dentists, doctors, health professionals often they kind of run the industry. Now, what I mean is that because they are the face between the patient and the rest of the industry, which is kind of opaquely hidden behind them as such, they tend to think that they are the decision makers, but unfortunately they are in some ways, taking the management consulting word, siloed. Many practitioners work on their own, or they have a few clinics, like I ran a number of clinics in my younger days, etc. And they tend to not have the time to explore the technology to its depth to be able to apply it. Only about 4 or 5 weeks ago, and I will not the person's name, but we were talking about the application of AI in the industry, and a frontline practitioner was highly intelligent. Obviously, he's purchased crypto, he's used blockchain technology, but he was questioning whether AI was going to have an impact on business management and people care. He said, give me just one example. I gave him 3 off the bat, and then Dr. Colum emailed him and gave him something like 10. So the frontline practitioners just simply, it's not the case of they're not intelligent or even world-wise, they just don't really have the time to examine the technology in its depth. However, the board level of major companies does have that power. There is no reason, I mean, Akash, I'm sure based on your academic background, and Sean as well, your experience, there's no reason why, Akash, you couldn't stand in front of, Main Health, the board of directors, or a large-scale publicly listed company and just tell them, these are the efficient ways you can use and implement blockchain and AI to improve how things work. And to me, I made that clear in the book that I'm publishing soon, Healthcare 4.0, but it really comes down to board level, top-down approach. And if they're educated, I think it wouldn't take me more than 30 minutes without sounding, cocky. It wouldn't take me 30 minutes with, the Department of the Health and the senior ministers in bureaucracy to educate them about the benefits. But the want and the desire has to be there, and I think they are actually the leaders. So if I could make a call to the CEOs of major healthcare organizations, they need to be the first movers. I wouldn't call it early adopters anymore. They need to be the first movers. Early adopters has come and gone. Now it's a case of there needs to be major moves done from the higher ups. And then I can work with time and other clinicians like Dr. Colum who understand the technology, and then we can start educating the actual clinicians on the different tech stacks and why we're using this tech stack. But I think it's very hard to expect change to come, and it's unrealistic and unfair to expect a single clinic practitioner who's already overwhelmed with costs of management running his clinic or her clinic, and then expect them to adopt a new technology and way of doing things. It's just not going to be practical. So I'd say that it has to start from high up, and the education and the action has to start from board level, top-down approach, and then government bureaucracy at high level has to start enacting this change and making this happen. And I believe the kind of dynamic we'll be talking about, I think it is countries that, like India, where there isn't a strong infrastructure that has agreed. So I would appeal very much to these governments of large-scale populations to be the first movers. And then I think other countries can fall in line behind them. And then finally, as I said, and I say that with respect to being a clinician in the past, it's then the dentists, doctors, healthcare practitioners, vets, frontline clinicians can then come to the table. So that's my opinion.
Great points there, Rahul, and I definitely couldn't agree with you more that this definitely has to be top-down, because whenever we're talking about a new technology, that real understanding of the confidence level and the belief in it has to flow from the top. And for that, education, of course, plays a very important role. And the other aspect that you bring up in terms of countries like India, for example, where there's a much larger opportunity. So we saw this.
Can I also just step in with a question?
Yeah, go ahead.
You blockchain, crypto seminars, workshops and stuff generally?
Sorry, say that again, please.
You've been to a few seminars, workshops like I have, right? And honestly, if you can count on your hand, percentages, how many actual CEOs of large-scale organizations attend those?
Yeah.
Usually, they're very much people who are passionate about the technology, young guys who are out, screaming for a voice to say, "Hey, this tech is useful. Let's integrate, into bigger institutions." Very rarely, other than a person who gets sent from the banking sector to explore whether this technology is going to make them obsolete or not, you actually meet board-level people taking this technology seriously. Anyway, sorry, I digress a bit, but you know what I mean, Akash?
No, I totally get that, Rahul, and I think we had a long discussion on this maybe about a month back when we were chatting about this, right? So, and that also had to do with the larger environment, is what I think, in terms of all the rug pulls that were happening, the hype that was around it. So a lot of folks did not really understand as to what was really going on. So they could not separate the reality from what the fiction was, and fiction tends to be much more stronger, almost every time. And then of course they're busy in their day jobs. But that definitely is not really an excuse for not really going out and trying to identify as to what really is other developments of the new technologies. They have resources, absolutely.
Yeah, and to be able to enact digital health transformation from a top-down level, yes, it's a pain. We all know it's a pain to change the way we're doing before. But if that's going to benefit the patient and also improve your bottom line,
absolutely. Yeah. All right, so we are just getting out of time here. So, Dr. Ramit, thank you for your patience. You've been waiting for a long time. Let me just bring you up on stage. And here you are. Please go ahead.
Hi, everybody. Am I audible?
Yes, you are, Dr. Ramit. Please go ahead.
Thank you, Akash. I mean, I'm pretty glad that we all share the same passion and, the knowledge, and I'm pretty, fortunate to be listening to you all. I mean, industry experts, JP, Akash, Bhai, Rahul. I'm pretty, resonating with the same concepts, like how digital health is transforming healthcare. Me being a cardiologist and entrepreneur, I have a hospital and I'm using digital approach, to improve, to build more trust. Somebody did mention that early response and its action. I mean, somebody was discussing about. Well, I mean, to further elaborate on this, I've been running digital AI clinics in cardiology in rural villages in India.
That's fantastic.
And AI is really helping me out to diagnose AFibs, cardiac MIs, and I have proven data where, we've been helping these patients reach a hospital in earlier time using, cloud-based solutions. And now...
Amit, sorry to cut you off. Just a quick question. And this was self-driven, right? Self-motivated.
Yes.
That's amazing. Absolutely amazing. And that's another testament to blockchain and AI is the ability for you, powers you. So sorry to cut you off.
Yeah. And now, I'm working with few companies on India being a large populated nation where counterfeit medicines, counterfeit devices, tests, many. So blockchain. I'm working on a POC with a couple of companies. I have more than about 100 patients' data with me on the POC, which is trying to collect more data, with more patients getting really into using this blockchain technology to kind of further empower themselves. Somebody did mention, JP did mention about empowerment of their own data, control of their own data. Amazing. I mean, here you could see the results. Patients are able to, vouch that, yes, doc, you've been building more trust post-COVID. Yes, the medicines which I'm taking are really the most genuine ones which you prescribe. It's not been changed or counterfeited. Yes, right from the supply chain to patients consuming it. Blockchain, yes, is going to be the next, game changer in the overall trust building. And I'm sure, me being in India, in Gujarat, we've been able to create a digital dome of healthcare in cardiology rather. So rather, I have a larger roadmap where, a health wallet probably, can definitely be more incentivizing to a patients on their own health data. And end of the day, give more transparency to what we, as cardiologists, we kind of advise. Yes, this digital AI is going to really help me in my approach to help my patients rather. Thanks. I'm pretty intrigued, listening to you all, and I'm sure more is yet to come in the next few years. So, this was just what, you all were talking, and I'm seeing the results in my own hand. The POC on pharma, the POC on stents, and the digital AI solutions on rural cardiology, the cloud-based solutions are really now giving, the real shape to a patient. Patients are really loving it. And I have the first India's Metaverse Center in my hospital where my post-cabbage patients are really loving the experience of Metaverse solutions. Where educating people, educating my manpower about, how quality is really important, and patient about how, educating them about the hospital, about the procedure, about what kind of procedure they're going to do it on
That's
themselves.
right.
Amazing. This is digital is the next revolution. I feel being into cardiac space. I'm being more of a digital doctor now. But I really watch, for all, what JP said, what Rahul said. Amazing. This is the results I can share. Certain, use cases results to you guys. This is the next future.
Well, that's really
Thanks a
fantastic.
lot for that testimony. That's fantastic.
And a new solution of fintech is going to be, coming up in the next 6 to 8 months. Where JP did mention how the solutions can really incentivize the patient, incentivize the medical practitioners, incentivize the paramedics to rather be motivated to the system, rather also be governed and also be incentivized.
Dr. Amit, I would say but sorry, the only thing I disagree with Dr. Amit is 6 to 12 months. I'd say maybe 2 to 4 weeks, hint, hint.
Oh, really? Wow. I'm talking about the Indian, because I have multiple things to do at the same time. Me being an entrepreneur in my hospital, I have really a lot of things to take care. Yes,
It's very impressive given your workload that you're even looking at this. And I think one thing, sorry to cut you off a little bit, one more thing, and I think one major point, the word trust has come up a few times in this way. I only strongly and fervently believe that integration of blockchain and AI solutions by the whole industry of healthcare, practitioners of higher ups, will only bring the patients and engender and more trust with them, which means that they'll trust our whole healthcare system better, which means that they will come to the party as well, but the lead has to come from us.
Absolutely. I'm with you.
I'm gonna hazard myself to a prediction. Sorry to cut you. I think we're standing at a time where we're a little bit like the music industry before Napster. I don't know if that brings memories. You used to buy your records, etc. And then during Napster times, it was the big chaos, the pirates, and then you could start streaming for free and all of that. And then today, where we are with the music industry is we pay for streaming. And it's become, like a given that you just pay a subscription and you can find all the music that you're looking for, and you don't need to own this anymore, right? So I feel that with these decentralization models and this blockchain technology and this, when we adopt this, the user experience, which should be as simple as, you have a lot of people trying to self-medicate, they're trying to understand, they go to Dr. Google, now it's Dr. GPT. And so we have a growing need of people who are actually wanting to take control of their own health, but they don't know how, and they do need help. And we can't, otherwise we get weird biohackers out there, and no disrespect to them, I love biohackers in some ways, but some of them just throw the kitchen sink at themselves, and their only metric is whether I feel good or I don't feel good, right? I want to put framework around this. I want to be able to actually empower them to...
Sorry, also bioethics, I believe, is the counterbalance. There's biohacking and
That's right.
Yeah.
I think they need framework around what they're doing, and there can be a needle where the buck stops, where you'd be able to be empowered to do things by yourself with the right AI advice. And it should be that you can access your health professional instantly when you need actually to check something or to refer and then get further advice. Not just abandon people to Google and their own experiments. So I think that's what we're trying to build, this idea of empowering users and motivating them and making sure they can be taken by the hand and onboarded onto their health journey. It's really about the user experience. It's really about delivering them the advice through aggregating all of the data in one place. Think about the experience. Now, we talked a lot about infrastructure systems. Now, if I have all my data with me, like my portable data lake, I can actually walk into a health practitioner, tap their computer, and open a session on their computer automatically, a browser session, where they can see all my data and they can put some notes into it and make some diagnosis and maybe capture a piece of it and do something with it. They can enlist me into a clinical trial, etc., etc. So because the user is in control, he's at the center and he carries everything with him. That's the big game changer that we're trying to bring.
Absolutely, I'm with you all. Yeah. Thank you.
All right, thank you so much, Dr. Amit, and you're doing some fantastic job here, so maybe we should connect later and talk more about it.
Yeah.
So thank you so much for sharing with us.
Yeah, thank you, Rahul. Thank you, JP. Prakash.
Thank you.
Thanks.
Thank you so much, everybody.
Yeah.
All right, guys, this has been an absolutely fantastic discussion. We're just over time now, so Rahul, Jean-Philippe, can't thank you enough. I think we can make maybe another 100 podcasts out of everything that we talked about. There's so much happening, honestly. I mean, it gives me a million thoughts in my head, right? So there's so much, we can just pick up one thing and, dig in real deep, and there'll be so much value to be created for everybody. So thank you again. Thank you for taking time to do this with us today, and look forward to maybe another session very soon. And thank you, Sean, as always.
Thanks, guys. Yeah, thanks very much, everyone.
Thank you, guys. Thank you so much.
Thank you.
Much appreciated.
Bye, guys.
All right.
Cheers. Bye-bye.